This is the Fix Your Sciatica podcast.
And we are back. We spent the past few weeks actually trying to dive into the hardware and software of your body. So that includes the nerves, movement patterns, and the brain's alarm system. But today I wanted to pull back the curtain on the business side of your recovery. And as a physical therapist and entrepreneur, I see the world through a dual lens. I see the clinical outcomes you need, but I also see the economic incentives that actually drive the clinics and the businesses that you visit, especially in this space. And the truth is, the way healthcare is structured often creates a direct conflict with your goal of getting better quickly. In almost every other industry, restaurants, gyms, airlines, and others, the goal is often retention. It costs significantly more money and time to acquire new customers than it actually does to keep one. So to have a healthy business, you want to have people stay long term. But healthcare is different, or at least it should be. Because success in my world means that I've fixed your problems so well that you don't need me anymore. And in a traditional business sense, the better that I am at my job, the harder it is on my bottom line because I have to constantly find new patients and clients to replace the ones that I've successfully healed. So this leads to the healthcare paradox. Are patients being held onto longer than necessary just to satisfy a specific business metric? And so the only other industry like this is the dating world. Apps like Hinge say that they're designed to be deleted. And if the app works where you find a partner and leave, so again, they're losing another client. So healthcare should be the same, where success equals a deleted patient. The only reason you should, in quotes, resubscribe is that you have a new injury and not because the original one never went away. You're often going to be sold 12-week transformation packages or longer for thousands and thousands of dollars. And the industry actually justifies this with two major arguments, which includes motor control and tissue capacity. And so for the first point, motor control, this is a learned skill. And so the idea is that once I teach you how to move, it's going to have to be a conscious focus for you that you should be practicing every day regularly on your own. You shouldn't have to pay a professional session rate just for me to supervise your practice once you've actually truly learned this skill. Number two is we look at tissue capacity. Now, we know that the biological healing of muscles, tendons, nerves, and any sort of irritation takes about 4 to 6 weeks per phase. So during that time, that 4 to 6 week phase, the progression often stays relatively the same, the exercises, the modalities. And so the question that we have to ask is, if the treatment modality isn't changing within that specific time frame, why is there a fee? And often those fixed cost packages are actually designed to stabilize the clinic's overhead and not accelerate your results. You might also have heard about value-based care as the solution. So in theory, value-based care means that providers are actually going to be paid for your outcome and not just your visit. But unfortunately, there's some drawbacks with value-based care as well. Most value-based care models today are actually just compliance models. They often track if a doctor filled out the right forms, or if the patient showed up, or if they stuck with their medications. They rarely track if you can actually pick up your child or go for a run again. And this leaves a massive information asymmetry gap, where the provider knows or may know the map of your recovery, and the patient often follows along blindly, hoping the dollars that they put into this transformation actually leads to results. So my challenge for you, if you're currently in a long-term plan or just start a long-term plan, I want you to take these 6 questions and bring them to your next appointment. A great provider will actually be excited to answer them because they want you to be the CEO of your own recovery. The first question is going to be, what is the specific skill I am learning this week that I can't practice on my own? This is going to be justifying why you're meeting with this practitioner versus them just watching you do exercise after exercise or just being a rep counter. Number 2, is today's visit for a clinical intervention or just supervision? Again, reiterating, is it supervision or is it an actual intervention? Number 3, if I hit my functional goal or if I hit my functional goals in 4 weeks instead of 12, what happens to the rest of my plan? It allows you to future project. Number 4, beyond feeling less pain, what other objective functional metrics are we tracking to prove that this plan is in fact working? Number 5, if we don't see a change in my symptoms in the next 3 visits, what is our specific pivot strategy? And I think this question is actually primarily important because oftentimes you're going to be given a plan and you're going to be following it straight through. And so what if it doesn't work? And I think it's important because, especially in the world of pain management, not every intervention is going to work for you, although most interventions will actually be effective for a lot of people. So it is important for us to be able to have contingencies and recognizing if this plan doesn't work, what is our path moving forward? And then number 6, what is one thing that I can do today to make our next scheduled visit unnecessary? And what this is going to do is going to allow you to really maximize the effect of the treatment, the protocol, whatever you're following, and that way have it apply to recovery. And so because I've seen these flaws in the system firsthand, I've actually decided to build a model that actually aligns my success with your independence. So I'm going to be, like many providers, going to be moving away from the indefinite treatment model. Also, unfortunately, it's not necessarily a one and done model, but want to introduce something built for the biological reality of healing. And it's called the 30-day anti-fragile intensive. And the question is, why 30 days? Well, that's because it's the critical window where you actually get to learn the motor skills we've discussed, and there's going to be a fair amount of motor skills that we need to develop, where your tissues need to first heal. But also, it's going to be an intensive sprint designed to give you the map, the movements, and the mindset to manage your own pain without being tethered to a clinic for a full quarter of a year, for a full 12 weeks. The goal isn't to keep you in my office, it's to make you anti-fragile, so that you aren't just pain-free, but you are resilient enough to handle life stresses without a relapse. So if you're just tired of being a metric, a number in someone else's business, and you're ready to become an expert in your own recovery, head over to ifixyoursciatica.com to learn more about the 30-day intensive, and let's get you to a place where you can delete me from your life. And next week, we're going to go back to the movement aspect of this podcast. We're going to be focusing on the top 3 exercises that I often use to jumpstart recovery for nearly every pattern that we've discussed. Talk to you soon. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.